Every single day, 37 million Americans wake up with their sinuses completely blocked. Not just stuffy, not just congested, completely sealed shut. They cannot breathe through their nose. They cannot taste their food. They cannot sleep lying down. And here is what almost nobody realizes. In 70% of those cases, the problem is not an infection. It is not allergies. It is not even inflammation. It is trapped fluid that your body already knows how to drain, but something is blocking the signal. Subscribe to Dr. Waterling right now and hit that like button. We are working toward building this channel on one principle. The healthcare system profits when you stay dependent on decongestants and antibiotics, not when you learn to clear your own sinuses in 90 seconds, using knowledge that has existed for 3,000 years. I need to be direct with you. Chronic sinus congestion is not a minor inconvenience. In medicine, we call it chronic rhinosinusitis, and when it runs unchecked for years, the consequences become serious. Sinus infections can spread to the eyes, causing vision damage. They can spread to the bones of the skull, causing osteomyelitis. In rare but documented cases, they can spread to the brain, causing meningitis. I am not saying this to frighten you. I am saying it because once you understand what is actually happening inside your skull, the motivation to fix it becomes very concrete. Most people believe sinus congestion happens because of mucus overproduction. That is partly true, but it is not the mechanism. Let me explain exactly what is happening inside your head right now. Your sinuses are hollow air-filled spaces in the bones of your skull. You have 4 pairs. The frontal sinuses sit above your eyebrows. The maxillary sinuses sit in your cheekbones. The ethmoid sinuses sit between your eyes. The sphenoid sinuses sit deep behind your nose. These are not decorative. They serve critical functions. They humidify the air you breathe, they lighten the weight of your skull, and they produce mucus that traps bacteria and particles before they reach your lungs. Under normal circumstances, your sinuses drain continuously through tiny openings called ostia. These openings are approximately 1 to 3 millimeters wide, smaller than the tip of a ballpoint pen. Mucus flows through these openings into your nasal passages, where it either drains down your throat or exits through your nose. This drainage happens constantly, approximately 1 to 2 liters of mucus per day, and you never notice it because the system works flawlessly when everything is functioning correctly. But here is what nobody tells you. Those drainage pathways do not operate on gravity alone. They operate on something called the mucociliary escalator. The lining of your sinuses contains millions of tiny hair-like structures called cilia. These cilia beat in coordinated waves, roughly 12 to 15 beats per second, pushing mucus toward the drainage openings. Think of it like a conveyor belt made of microscopic hairs, constantly moving mucus in one direction. When inflammation occurs, whether from a viral infection, environmental irritants, or allergens, the sinus lining swells. That swelling narrows the ostia, the tiny drainage openings. At the same time, inflammation slows down the cilia. The conveyor belt stops moving efficiently. Mucus that should drain in minutes sits stagnant for hours, then days. Stagnant mucus becomes thick. Thick mucus blocks the ostia completely. Once the ostia are blocked, pressure builds inside the sealed sinus cavity. That pressure is what you feel as the headache, the facial pain, the sensation of fullness. Now here is the critical part that conventional medicine completely ignores. Your body already has a built-in mechanism to restore drainage. The trigeminal nerve, the largest cranial nerve in your head, controls sensation and motor function for your entire face. One specific branch of this nerve, the infraorbital nerve, runs directly beneath your cheekbone and innervates the maxillary sinus. When you stimulate this nerve at a precise point, it triggers a parasympathetic response that causes immediate vasodilation, increased blood flow, and restoration of ciliary function. The drainage pathway opens. The mucus starts moving. The pressure releases. This is not folk medicine. This is documented neurophysiology. A study published in the American Journal of Rhinology and Allergy confirmed that acupressure stimulation at specific facial points increased nasal patency, the medical term for openness of the nasal passages, by an average of 40% within 2 minutes of application. So, what does conventional medicine give you instead? Decongestant sprays that shrink blood vessels temporarily but cause rebound congestion when you stop using them. Antihistamines that dry out mucous membranes, making the mucus even thicker and harder to drain. Antibiotics prescribed for viral infections where they do nothing except destroy your gut microbiome. Steroid nasal sprays that reduce inflammation but do not restore the drainage mechanism. And when all of that fails, they recommend sinus surgery to physically widen the ostia, a procedure that costs $20,000 to $30,000 and has a 30% recurrence rate within 5 years. Nobody in a 12-minute office visit is going to teach you about the infraorbital nerve. There is no billing code for acupressure instruction. The system makes money when you refill prescriptions monthly, not when you learn to drain your own sinuses in 90 seconds. Let me tell you about Patricia, 58 years old. She came to my office convinced she had a chronic sinus infection. She had been on 3 rounds of antibiotics in 6 months. Every time the antibiotics finished, the congestion returned within a week. She could not sleep lying flat because the pressure in her face became unbearable. She had stopped exercising because any exertion made her feel like her head would explode. Her doctor had scheduled her for a CT scan to evaluate for surgical intervention. I examined her. No fever, no purulent discharge, the thick yellow-green mucus that indicates bacterial infection. Her sinuses were tender to palpation, but that indicated pressure, not infection. I taught her the acupressure point I am about to teach you. She performed it sitting in my office. Within 90 seconds, I watched her eyes widen. She said, "I can feel it draining." Nestansinines. Within 5 minutes, she could breathe through both nostrils for the first time in months. I told her to perform the technique 3 times daily for 1 week. She came back 2 weeks later. The chronic congestion was completely resolved. No antibiotics, no surgery, no expensive interventions. Just anatomical knowledge and 90 seconds of focused pressure 3 times per day. Now the acupressure point. This is the exact protocol, step by step. Locate the point first. Place your index finger on your cheekbone directly below the center of your eye. The anatomical landmark is the infraorbital foramen, a small opening in the bone where the infraorbital nerve exits the skull. You will feel a slight indentation in the bone approximately 1 centimeter below the lower rim of your eye socket. When you press gently, you should feel a distinct tingling or mild ache radiating across your cheek. That sensation confirms you are on the nerve. Here is the pressure technique. Use the pad of your index or middle finger, not the tip. Apply firm, steady pressure directly into the bone, not pressing downward toward your jaw, not pressing sideways. Pressing straight back toward the back of your skull as if you are trying to push through the cheekbone. The pressure should be firm enough to feel distinctly uncomfortable but not painful. If you are grimacing or pulling away, you are pressing too hard. If you barely feel anything, you are pressing too lightly. Hold that pressure for 10 seconds. You will feel warmth spreading across your cheek. That is increased blood flow. You may feel a tingling sensation radiating up toward your eye or down toward your upper lip. That is normal. That is the nerve responding. After 10 seconds, release the pressure completely for 5 seconds. Then apply pressure again for 10 seconds. Repeat this cycle 5 times on each side. Total time, approximately 90 seconds per side, 3 minutes total for both sides. Perform this technique 3 times daily. First thing in the morning before you get out of bed. Midday, ideally before lunch, and in the evening, 1 hour before sleep. Consistency matters more than intensity. 3 gentle sessions daily outperform 1 aggressive session. Now, here is what you should feel during and after the technique. So, as a dasais nasad nendorphrandis. During the pressure application, you may experience increased tearing from the eye on that side. Mundas firstir inside that is normal. You may feel a sudden urge to swallow. That is mucus beginning to drain down the back of your throat. You may taste salt or a metallic flavor. That is stagnant mucus entering your throat. Within 2 to 5 minutes after completing both sides, you should feel a distinct sensation of drainage. Now, kinstaz dans as din bright. Some people describe it as a pop or release feeling. Others describe it as warmth spreading through the sinuses. Many people experience a sudden ability to breathe more deeply through the nose. If you blow your nose gently after the technique, you may expel a significant amount of mucus. That is exactly what should happen. By the end of the first day, you should notice reduced facial pressure. By the end of the first week, chronic congestion that has persisted for months should be 60 to 80% improved. By the end of 2 weeks, most people experience complete resolution. Now, critical warning. If you have acute bacterial sinusitis, you will know because you will have thick yellow or green discharge, facial pain that worsens when you bend forward, fever above 38. 3 degrees Celsius or 101 degrees Fahrenheit, and symptoms that worsen after initially improving. That is bacterial infection requiring antibiotics. This technique supports drainage, but it does not replace antibiotics when bacteria are present. If you have sudden severe headache, vision changes, confusion, or neck stiffness along with sinus symptoms, that suggests possible spread to the brain. That is a medical emergency. Go to an emergency department immediately. If you have had recent facial trauma or facial surgery, do not perform this technique until cleared by your surgeon. The pressure could disrupt healing tissue. If you are on blood thinners, be gentle with the pressure. Excessive force could cause bruising in the sinus cavities. This technique works for functional sinus congestion caused by inflammation and impaired drainage. It does not address structural problems like severe deviated septum or nasal polyps that physically block the airways. If you perform this technique consistently for 3 weeks and see no improvement, you need imaging to evaluate for structural obstruction. Here's your complete protocol organized as a daily schedule. Morning, immediately upon waking, before getting out of bed, sit up against your headboard or wall. Perform the acupressure technique on both sides, 5 cycles of 10 seconds pressure and 5 seconds release per side. Blow your nose gently afterward. Drink a full glass of room temperature water to thin mucus secretions. Midday, before lunch, perform the technique again, same protocol. If you are at work or in public, you can do this discreetly. Nobody will know what you are doing. It looks like you are simply pressing on your face, which people do constantly without drawing attention. Evening, 1 hour before sleep, perform the technique a final time. Then perform one additional step. Fill a bowl with hot water, not boiling but hot enough to produce steam. Drape a towel over your head and lean over the bowl. Inhale the steam through your nose for 5 to 7 minutes. This humidifies the nasal passages and supports continued drainage overnight. Add 1 drop of eucalyptus oil to the water if you have it, but this is optional, not required. Sleep with your head elevated on 2 pillows instead of 1. This uses gravity to assist drainage overnight and prevents mucus from pooling in the sinuses. Avoid dairy products for 2 weeks while implementing this protocol. Dairy does not cause mucus production, but it does make existing mucus thicker and more difficult to drain. Avoid alcohol, which causes vasodilation and can worsen congestion. Drink at least 2 liters of water daily to keep mucus thin and mobile. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. Let me address the question everyone asks. Why does this work when nothing else has? The answer is simple. Decongestants shrink blood vessels but do nothing to restore the drainage mechanism. Once the medication wears off, the congestion returns because the cilia are still dysfunctional and the ostia are still swollen shut. Antihistamines block histamine receptors but do nothing to move stagnant mucus. Antibiotics kill bacteria but do nothing for viral infections or inflammatory congestion that contains no bacteria. This technique works because it directly addresses the root mechanism, impaired nerve signaling to the sinus lining. When you stimulate the infraorbital nerve, you restore parasympathetic tone, which increases blood flow, reactivates the cilia, reduces inflammation, and opens the drainage pathways. You are not suppressing symptoms. You are restoring normal physiological function. In 15 years of clinical practice, I have taught this technique to hundreds of patients. The overwhelming majority experience significant improvement within 3 days. Many experience complete resolution within 2 weeks. The ones who do not improve fall into 2 categories: those who have structural obstruction requiring imaging and possible surgical correction, and those who are not performing the technique correctly, usually pressing too lightly or in the wrong location. If this video helped you, send it to someone you care about, a parent, a friend, someone who has been suffering with chronic sinus congestion and spending money on sprays and pills that provide only temporary relief. You may have just given them the information their doctor never had time to explain. Your body is not broken. Your sinuses are not your enemy. They are a drainage system designed to work flawlessly, and when the signal is blocked, you have the knowledge to restore it. 3 minutes a day, no prescriptions. No side effects. No dependency. Just anatomical knowledge that has existed for thousands of years, now confirmed by modern neurophysiology. Subscribe to Dr. Waterling if you want more content like this, information the medical system will not give you because there is no profit in teaching you to fix yourself. We are building a community of people who understand that health is not something you buy from a pharmacy. It is something you restore through knowledge and consistent action. Your sinuses will drain completely if you do this. The pressure will release. The headaches will stop. You will breathe clearly again, not because of expensive interventions, because you understand your own anatomy and you know exactly which nerve to stimulate to restore the function your body was designed to perform naturally.